pleasure to be here to present what we are doing in terms of sustainability research at NOVA National Public Health School. So, as you know, public health is a science of preventing disease, prolonging life, and promoting health. And indeed, it takes the effort of all society. I'm not going to take too much time talking about the SDGs because I'm the last presenter, so we have been heard about it. But indeed, our main focus is in Goal 3 about health, ensuring health lives, but also promoting well-being at all ages. And it's also full aligned with the Health 2020 framework. But if health has a specific goal, we also know that most of the health targets are presented in almost all goals. And indeed, health and well-being are both drivers, but also outcomes of the sustainable development. So if we think about taking action to promote health and well-being, I should say that maybe we have to focus on what we call 5 Ps as a key strategy to achieve these goals: people, prosperity, peace, partnership, and planet. So we have to take all these together in order to try to achieve these goals. I'm going to show very quickly some of the projects that we are conducting now as a Public Health Research Center, but also as a public health arm from the Comprehensive Health Research Center that we are also part. And I must say that we mainly work in 4 main areas: health policies, health promotion and health inequalities, health services, and occupation and environmental health. And I'm going to show several projects, very brief, in several areas. To give you an overview of the principles or the pillars that we have, mainly one of them is behavioral and community insights. So we're trying to engage communities, and one of our colleagues said that their research was much more related with people, and I say that we also do like that. So we engage communities and multi-sector actors to understand what are the health needs from their perspective. And this is very, very important, and we are changing the way that we are doing research in this area. Also, we have another important dimension, that is people-centered bottom-up approach. So we try to understand what are the barriers and facilitators for healthy lifestyles and use of health services. And then I'm going to present you several projects that give some examples. And last, we explore individual, social, and institutional factors when we try to tackle the social determinants that we have heard also that it's very, very important for health and well-being. So indeed, what we try to do is to understand what are the needs, what works, how it works, why it works, for whom, and with all these evidence, we try to support the evidence-based policies, but also the decision-making of communities. So we try for all these strength alliance for health and well-being across all sectors. We know that this is not very easy to do, but we really understand and we really believe this is the way that we should do our research. So one of our main areas of research nowadays, it's health literacy, and we know this is a key determinant of health. Not only to understand, for example, what are the factors linked with access to health services in a broader way, but also to understand from the community sector what are the needs they have and what are the important information they need to understand in order to make good decisions for their health. And also health literacy, and those who have studied health literacy for a long time, they are showing a very strong link with several sustainable goals. So this is a very important issue. In this area, we have now 2 projects that are linked with National Health Literacy Demonstration Projects. It's a program in WHO linked with non-communicable diseases, and we have 2 projects running nowadays. One is in the prevention of diabetes, and the other one is with migrant health, and I'm going to explore a little bit better this project. And the other one, it's just an example. We also work with families and other caregivers for promoting healthy growth from children from the pregnancy until 5 years. We focus on, for example, feeding, physical activity, sleep, and other important areas. Regarding the project that I was talking about migrants, and I don't have much time to go deeply in each project, but it's an implementation research with a participatory approach with several stakeholders to optimize health literacy, health promotion, and very important social cohesion. And indeed, we are working with migrants, but also social and health sector in order to improve health outcomes and reduce health disparities. So what we are doing at this moment, even with all the difficulties that we know that we have in the field, we are trying first to characterize the health literacy level of migrants. We are interested in understanding the different migrants with different backgrounds, but we are very much interested in the most recent ones that we know that they face more difficulties in the host country. And then we are going also to do a local needs assessment. So it's really important to have the idea of the community, of the populations, and not only as an experts in these fields. Then, with all this evidence, we are going to co-design interventions and using innovative solutions. We want to use e-health in this kind of interventions. And after, we are going to implement these strategies in the field in order to scale up for other regions of Portugal, but also because we are working with other European partners, we also, and WHO, so we want to use these interventions to scale up for other European countries. Another one, and this is an important project with the principle of leaving no one behind. It's a project that started last year from Horizon 2020, and it's Elevate, it's the name of the project, and we aimed to develop a new cervical cancer screening with a HPV self-sampling test using a user-friendly, low-cost and portable screening pilot. And we are at this moment trying to understand the acceptability of this intervention. We have also partners from the technology parts developing the device, and then we are going to test this mostly with social disadvantaged women, most of them also migrants, that we know that they face several barriers in this cervical cancer screening. We have several, I was talking with another colleague during the break, we are facing several difficulties in the field at this moment, but we think that we are now organizing the project, so probably the next year we are trying to start the pilot phase. Another project that I would like to briefly present you is a winner of the prize Sustainable Health last year, and it's what we call social prescribing. We are working with primary health care. Social prescribing, for those who doesn't know the concept, enables that general and family practitioners address non-medical causes of ill health by linking primary health care patients to non-medical community sources of support. And we are evaluating the impact of this intervention, and it's quite interesting to not only to work in the field with health care sector, but to understand how we can link indeed the health and the social sector that normally it's working in very different ways. So we want to impact in to understand the impact in people, so improving health, quality of life and well-being, what kind of impact this intervention has in people. We also want to understand the health system impact for example, improving the efficiency and the sustainability of national health services. We know that most of the time people doesn't have really a very huge problem in health. It's much more related with social determinants of health. And last, we want also to improve the collaboration, as I said, for health and social sector. Then I am going to move to another dimension. Health service research is a huge part of our research in our center, and I'm just going to mention one of the dimensions, that it's safety and quality in healthcare. We were designated for a WHO collaborating center very recently, and it's a research collaborating center for education, research, and evaluation of safety and quality in healthcare. We also have a new project from Cost Action, that it's a research network for working on the second victims, and indeed we are working in terms of concerning and trying to understand more the adverse events of healthcare institutions and to implement joint efforts to support second victims. Another important topic that we are now starting with more projects and more joint initiatives is the environmental and occupation health. We know that it's a very important area of sustainable development goals, and we all know the impact of environmental in our health, so I'm not going to describe this in very detail. Just to give you some joint initiatives that we are also working. So one of them is to understand what is the impact of climate change and in terms of public health implications. We have several projects that we are working now. One is by monitoring the actual exposure of EU citizens to chemicals. Another one is to also understand what is the occupational exposure to microbiotic in clinical settings, and also to contribute for other projects with terms of food security and safety. So we have several initiatives at this moment in terms of environmental and occupation health. Last, I would like to just to give you a quick overview of COVID. We know this is a new world with very challenging times. We know that COVID will probably negatively influence the impact of us to achieve in all sustainable development goals. I don't have to go very detailed in each one, but we know that this is the effect. Also, as we have heard, COVID probably will intensify a lot. It is doing it now, but we know that it will be probably much worse, the social and the health inequalities. So it is a very important area in terms of public health. So we have started, at National School of Public Health, we have started a new line. We call it Covid19 Barometer. We have 4 main dimensions in this line. One is social opinion. It's a survey where we really want to understand what is the opinion of people regarding the impacts of the measures that we are conducting. So trying to understand the impacts in terms of physical health, mental health, also the social impact. So we want to understand the ideas. We started this survey from the beginning of in March, so we have all the data monitoring what was the opinion of people, and it was one of the projects that were financed with FCT. So we are going to monitoring this, and now in this new project that it's COVID-19 or social opinion, we want also to try to understand the link with health services, what is happening with those who are not COVID patients. And we have 3 projects financed. One is regarding hospital production. Another one is to understand better the data to intervene. And the other one is also regarding another area very important, that it's violence and how COVID, its impact, the victims of violence. Just to end, so we are trying to have this sustainability agenda in our research. We want also to continue fostering our partnerships for innovative and collaborative partnerships, and we want also that our research can be translated in research in terms of health outcomes for people. So we don't want to do only research for our academic papers or other reports. It's really important, but we really want to have that our research has impact in people's lives. Thank you very much.